Are you always feeling tired? Not in the mood for sex? You are gaining weight, but yet your muscles are going. That aside, you are always down. And that gets you thinking, what is actually wrong? Is my testosterone low? As a nurse, I usually get these questions a lot on my DM and also on the comment section. The big question is, what is this testosterone? Testosterone is a particular male hormone, is the main male hormone, is the number one hormones in men. This particular hormone is produced in the testes. This particular hormone is responsible for the male characteristics. You see those energy you have, you see your mood, you see your sex drive. It is the testosterone that is responsible for it. And when there is a low testosterone, definitely you are likely to feel off. Good day, everyone, and welcome back to Nurses Lecture Room. My name is Mercy Mary, popularly known as the Nurse with a Difference, and I make learning easy and accessible for all my viewers. On this video, I'm going to be simplifying the different causes of low testosterone so you have a better understanding and a better knowledge. Because one thing I'm sure of is that when you know the cause of a thing, it is easier to actually get it sorted out. When you know the problem, it is much easier to provide solution. But if you don't know the problem, then solution becomes difficult. So on this video, we're going to be talking about the cause, what is actually causing that low testosterone. If you are new on our YouTube channel, please click on the subscribe button, turn on the notification bell so you don't miss out when we drop a video. All right, welcome back. Now, let's talk about the causes of this low testosterone. Yes, you heard me right. For your testosterone to be produced, for you to have normal testosterone, a lot of things are involved. It's not just the testes that is found in your scrotum. The testes are involved. Your brain is involved. The pituitary gland and the hypothalamus are involved in the production of this hormone known as testosterone. And if anything affects the brain, anything affects the hypothalamus, the pituitary gland, or the testes itself, that can result in low testosterone. That is why when it comes to the causes, it is actually divided into two. We have the primary causes and the secondary causes. Primary causes of low testosterone and the secondary causes of low testosterone. Low testosterone is also known as hypogonadism. So we have the primary hypogonadism and the secondary hypogonadism. Now, let's talk about the primary hypogonadism. When we talk about the primary hypogonadism, what is being affected majorly is the testes. What is being affected majorly is the testes. While in the secondary hypogonadism, what is being affected is the part of the brain where you talk about the hypothalamus and the pituitary gland that regulates the release of those hormones in the testes. The primary is talking about the testes, anything that affects the testes itself. While the secondary is talking about anything that affects the brain aspects, anything that affects the hypothalamus, anything that affects the pituitary gland that regulates the production and release of that testosterone. I don't know if I'm making sense. So the primary is the testes and the secondary is talking about the pituitary gland and the hypothalamus. In terms of primary hypogonadism, that underactivity of the testes, that issues with the testes can be inherited or acquired. Can be inherited or acquired. Examples of that issues that can be inherited is undescended testes. What do we mean when we say undescended testes? Undescended testes is a condition in which the testes fail to descend from the abdomen before birth. Normally, if the testes does not descend from the abdomen into the scrotum, after 12 months, like when the child is 1 year, the testes have not descended yet, a surgery is advised. That is number one. Then the second inherited condition that can cause issues with your testosterone production and the testes is what we call the Klinefelter syndrome. The Klinefelter syndrome is a condition in which the male have 3 sex chromosomes. Normally, the male are supposed to have the XY chromosomes, but in Klinefelter syndrome, the male have 3 sex chromosome XXY. And when it happens like that, it can result in issues with the testes that can lead to low testosterone. Third inherited condition is hemochromatosis. Hemochromatosis simply means too much iron in the blood, and that can result in testicular failure or pituitary damage. Now you know the 3 inherited causes of primary hypogonadism. So let's talk about the acquired. The number 1 cause when it comes to acquired is injury, physical injury to the testes. So physical injury to the testes can result in low testosterone, can affect the testosterone production. And the other is MOFs, MOF orchitis. MOF infection can injure the testes. Remember, when anything affects the testes, it can actually affect testosterone production. Then the third one is cancer treatment. Chemotherapy or radiation can actually damage the testes. So I believe now with this example, that gives you an insight of what is likely going to cause low testosterone. Now, let's talk about the secondary hypogonadism. Remember, in the primary, we have the acquired and the inherited. That also applies to the secondary. But first of all, in the secondary, let's talk about the inherited. In the inherited, we have pituitary disorder. This pituitary disorder can be caused by drugs, kidney failure, or small tumor. Then the second is the Kallmann syndrome. Kallmann syndrome. This is consigned or connected to abnormalities in the hypothalamus function. There's abnormalities when it comes to the hypothalamus. Then the third aspect is inflammatory diseases. Inflammatory diseases such as tuberculosis can also affect the pituitary function and the hypothalamus. And the other one is HIV and AIDS. HIV and AIDS can affect the pituitary gland and can also affect the hypothalamus. This is for the inherited. Now let's talk about the acquired. The acquired, the first one is normal aging. Let me tell you something. As you age, your testosterone tends to decrease. As you go above 30, 39, 40, your testosterone level tends to decrease with age. It's not going to be high the same way it was when you were in your 20s. So age is like a normal cause of low testosterone. Then the second is obesity. Yes, if you are overweight, you are obese, that can affect your testosterone production. That can affect your testosterone production because of the fat cells. Then the third is the medications. What medications are you on? Medications such as opioids, steroid can affect the pituitary gland and also the hypothalamus. Then the fourth is concurrent illness. So when you are having frequent illnesses, you are engaging in surgery, you are having like different medications, that's mental stress, that's emotional stress can actually affect your testosterone production. Lack of sleep is not left out. Lack of sleep is not left out when it comes to testosterone production. All these are the various causes of low testosterone. So what you have to do is to check and see which one applies to you. There are different methods in which you can sort this issue of low testosterone, and we are going to be discussing that in the next video. So you're done with the part 1 of this video. The part 2 is going to be dropping tomorrow. All you have to do is to turn on that notification bell, subscribe so you don't miss out when we drop the part 2, because the part 2 is very important, especially when you know you have low testosterone. Thank you very much for staying tuned. Thank you very much for watching this video. Don't forget to like, don't forget to subscribe, and also don't forget to share with a friend if you got value. For all my returning subscribers, this is Nurse Mercy Mary saying thank you. Bye and see you in our next video.